You wake up in the morning, and before you even open your eyes fully, you feel it, not energy, not freshness, but dryness. Your mouth feels like sandpaper, your tongue sticks to the roof, your throat burns slightly, and your lips feel cracked as if you haven't had water in days. So you reach for a glass of water, take a few sips, and move on with your day. You don't think twice about it. You tell yourself this is normal. Everyone wakes up like this. But what if I told you that this one small symptom, this dry mouth you've been ignoring, could be your body trying to warn you about something much more serious? Because in my years of medical experience, I've seen patients walk into clinics with major health problems that started with something as simple as this, and the most dangerous part, they ignored it, they dismissed it, they thought it was nothing. Dry mouth is not the problem. It's the messenger. It's your body quietly telling you that something deeper is happening while you sleep. And today I'm going to show you exactly what those signals mean, what could be causing them, and why paying attention to this one detail could potentially protect your long-term health. Now let's understand something most people completely overlook. Your mouth is not supposed to be dry even during sleep. Your salivary glands are designed to work continuously. Yes, they slow down at night, but they don't stop. Saliva is not just water, it's a protective fluid. It contains enzymes that begin digestion before food even reaches your stomach. It contains antibacterial compounds that protect your teeth and gums. It keeps the environment in your mouth balanced, preventing harmful bacteria from taking over, and most importantly, it keeps your oral tissues hydrated and healthy. When saliva production drops too much, everything changes. Your mouth becomes a breeding ground for bacteria, acidity increases, your teeth become more vulnerable, and over time, this can lead to cavities, gum disease, infections, and even systemic health issues. But here's the key point: your body doesn't reduce saliva without a reason. When you wake up with a dry mouth, it's not random. It's a signal, and understanding that signal is the first step toward fixing the real problem. The most common cause of waking up with a dry mouth is something incredibly simple but often ignored. It's how you breathe while you sleep. If you are breathing through your mouth instead of your nose, your mouth will dry out. This is basic physiology. Air constantly flowing through your mouth pulls moisture away from your oral tissues. And after several hours of sleep, that moisture loss becomes significant. But the real question is not, are you mouth breathing? The real question is why. Because your body is designed to breathe through the nose, mouth breathing usually happens when something is blocking your nasal airflow. This could be something mild like allergies or nasal congestion, but in some cases it could be something much more serious, and this is where people often miss the warning signs completely because they think it's just a habit. When in reality, it could be something their body is struggling with every single night. One of the most serious reasons behind mouth breathing during sleep is a condition called sleep apnea, and this is where things become dangerous. Sleep apnea happens when your airway partially or completely collapses while you sleep. Your body struggles to get enough oxygen, and in response, it forces your mouth open to try and breathe. You may snore loudly. You may wake up multiple times without realizing it. And in the morning, you feel exhausted even after sleeping for 7 or 8 hours. But here's what makes it truly concerning: every time your breathing stops, your oxygen levels drop. Your heart has to work harder. Your blood pressure spikes. Stress hormones flood your system. Over time, this puts enormous strain on your cardiovascular system. It increases your risk of heart disease, stroke, high blood pressure, and even sudden cardiac events. And for many people, the first visible sign of this entire process is a dry mouth in the morning. Now let me tell you something that might surprise you. Another major cause of dry mouth, one that people rarely connect, is high blood sugar. When your blood sugar levels are elevated, your body tries to remove the excess glucose through your urine. This means you urinate more frequently, especially at night, and every time you lose fluid, your body becomes more dehydrated. Over time, this leads to a constant state of mild dehydration, and one of the earliest signs of that is a dry mouth, but it doesn't stop there. You may also notice increased thirst, fatigue, blurry vision, or tingling in your hands and feet. These are not random symptoms. They are early warning signs that your blood sugar may not be under control. And the reason this is so important is because type 2 diabetes develops slowly. Many people live with it for years without knowing, and sometimes the only clue your body gives you in the beginning is something as simple as waking up with a dry mouth. Now let's talk about something that affects millions of people, and most of them have no idea it's connected to their dry mouth medications. If you are taking any regular medication, there is a very high chance that dry mouth is one of its side effects. And I'm not talking about rare drugs, I'm talking about some of the most commonly prescribed medications in the world. Blood pressure medications, especially diuretics, can reduce fluid levels in your body. Antihistamines, which people take for allergies, are notorious for drying out your mouth. Antidepressants and anti-anxiety medications can directly affect saliva production. Even painkillers and muscle relaxants can have this effect. Now here's the problem. Most people never connect their symptoms to their medication. They assume the dryness is just part of aging or something minor, but over time, this reduced saliva production creates a chain reaction. Your mouth becomes more acidic, bacteria multiply faster, your risk of cavities and gum disease increases, and what started as a simple side effect becomes a long-term health issue. The important thing is not to stop your medication, but to recognize the connection and talk to your doctor about possible alternatives or ways to manage it. Now let's look at something that sounds obvious but is often misunderstood: dehydration. Most people believe that if they drink water during the day, they're hydrated. But the reality is very different. A large percentage of people live in a state of mild chronic dehydration without even realizing it. And this becomes even more important. As you get older, your body's ability to conserve water decreases. Your thirst signal becomes weaker, so you can be dehydrated without feeling thirsty. Now add modern lifestyle habits to that. Coffee, tea, alcohol, these are all diuretics. They cause your body to lose more fluid than it takes in. Processed foods high in salt increase your body's need for water, air conditioning, and heating systems. Reduce humidity, pulling moisture out of your environment and your body. And when you go to bed in this slightly dehydrated state, your body continues to lose moisture throughout the night. By morning, your mouth feels extremely dry, and again, this isn't just about comfort. Chronic dehydration affects your circulation, your metabolism, and even your cognitive function over time. Now here's something most people never consider, but it's becoming increasingly recognized in medicine: autoimmune conditions. There is a specific condition called Sjogren's syndrome that directly targets the glands responsible for producing moisture in your body. This includes your salivary glands and tear glands. When this happens, your body literally loses its ability to produce enough saliva. And the result is persistent, severe dry mouth that doesn't improve even when you drink water. But it doesn't stop there. People with this condition often experience dry eyes, fatigue, joint pain, and a general sense of discomfort that they can't explain. The challenge is that this condition is often misdiagnosed or ignored for years. Many people assume their symptoms are just part of aging, but early diagnosis can make a huge difference, because untreated, it can lead to serious complications, including infections, dental damage, and even increased risk of certain diseases. So if your dry mouth is constant, severe, and accompanied by other symptoms, it's something that needs proper medical evaluation. Now let me take you into something that most doctors don't talk about enough: the connection between your mind and your mouth, stress and anxiety. When your body is under stress, it activates what we call the fight or flight response. This is your body preparing for danger, and in that moment it shuts down non-essential functions. One of those functions is saliva production. Your body redirects energy and blood flow toward survival systems. Your heart, your muscles, your lungs, and your mouth becomes dry. Now imagine this happening not for a few minutes, but for hours, even throughout the night. If you go to bed stressed, anxious, or mentally overwhelmed, your nervous system may stay activated while you sleep. This leads to shallow breathing, mouth breathing, and reduced saliva production, and you wake up with that same dryness. But here's the bigger issue. Chronic stress doesn't just affect your mouth, it disrupts your sleep, increases your cortisol levels, affects your metabolism, and accelerates aging. So that dry mouth may actually be a reflection of something much deeper: your mental and emotional state. At this point, you might be realizing something important. Dry mouth is not just one problem, it's a symptom with many possible causes. And that's exactly why it's so important to pay attention to it, because your body doesn't send signals without a reason. It doesn't create discomfort without a purpose. Every symptom is a message. And the people who stay healthy long term are the ones who learn how to listen. Now, here's the key question you need to ask yourself. Is your dry mouth occasional, or is it happening every single day? Because frequency matters, occasional dryness might be harmless, but consistent dryness is your body telling you something needs attention. It could be your breathing, your hydration, your medication, your blood sugar, or even your stress levels. And the sooner you identify the cause, the easier it is to fix. Because when you ignore small signals, they don't go away, they grow, and what starts as a small discomfort can slowly turn into a much bigger problem over time. Now that we've covered the possible causes, let's shift to something even more important, what you can actually do about it. Because recognizing the signal is only the first step. Taking action is what protects your health. And the first thing I want you to consider is your sleep, if there is even a small chance that you might have. Sleep apnea, don't ignore it. This is not something you can guess or fix on your own. You need proper evaluation. A sleep study, whether done in a clinic or at home, can give you clear answers. And if sleep apnea is diagnosed, the treatment can be life-changing. People often tell me that after starting treatment, they feel like they've woken up for the first time in years. Their energy improves, their mood stabilizes, their blood pressure comes down, and yes, their dry mouth disappears, because now their body is finally getting the oxygen it needs during sleep. The next step is hydration, but not the way most people think. Drinking a large amount of water right before bed is not the solution. In fact, it can make things worse by forcing you to wake up multiple times during the night to use the bathroom. The key is consistent hydration throughout the day. Your body needs a steady supply of fluids, not sudden overload. A simple guideline is to drink water regularly from morning to evening, rather than all at once. Also, pay attention to what you're drinking. Caffeine and alcohol both dehydrate your body, especially when consumed later in the day. Reducing these can make a noticeable difference, and something as simple as adding a humidifier to your bedroom can help maintain moisture levels in the air, preventing your body from drying out overnight. These small changes can create a big improvement over time. 2. Now let's talk about your medications. This is something you should never ignore. If you started experiencing dry mouth after beginning a new medication, that is not a coincidence. It's a connection. And while you should never stop medication on your own, you absolutely should have a conversation with your doctor. Ask about alternatives, ask about dosage adjustments. Sometimes a simple change can significantly reduce side effects without affecting the effectiveness of the treatment. And if switching medications is not possible, there are still ways to manage the dryness. Saliva substitutes, sugar-free gum, and proper oral care can help maintain moisture. And protect your teeth. The important thing is awareness. Once you recognize the cause, you can take steps to reduce its impact. Another powerful adjustment you can make is improving how you breathe during sleep. Your body is designed to breathe through the nose, not the mouth. Nasal breathing helps filter, humidify, and regulate the air entering your body. It also supports better oxygen exchange. If you are consistently breathing through your mouth, something is interfering with your nasal airflow. Addressing this can make a huge difference. This might involve treating allergies, managing sinus issues, or improving your sleep environment. Some people explore techniques like mouth tapping, which encourages nasal breathing during sleep. However, this is not suitable for everyone, especially if you haven't treated sleep apnea or nasal blockage. Always consult a professional before trying it. But the goal is simple: restore natural breathing patterns, and many symptoms, including dry mouth, begin to improve. Now let's address something that is often overlooked but extremely important: your oral health. If you are dealing with chronic dry mouth, your mouth needs extra care, because without enough saliva, your natural defense system is weakened. Bacteria are not being washed away effectively. Acids are not being neutralized properly. And your risk of cavities and gum disease increases significantly. This means you need to be more proactive. Brush your teeth at least twice a day with fluoride toothpaste. Floss daily, Avoid alcohol-based mouthwashes as they can make dryness worse. Instead, use alcohol-free options designed for sensitive mouths, chewing sugar-free. Gum can stimulate saliva production during the day. And most importantly, visit your dentist regularly. Early detection of dental issues can prevent more serious problems down the line, because what starts in the mouth doesn't stay in the mouth, it affects your entire body. Now let's talk about something deeper: your blood sugar. If you have not had your glucose levels checked recently, this is something you should seriously consider, especially if your dry mouth is accompanied by increased thirst, frequent urination, fatigue, or blurred vision. These are not random symptoms. They are signals that your body may be struggling to regulate blood sugar, and the earlier you detect it, the better your chances of controlling it. Prediabetes and early diabetes can often be managed effectively with lifestyle changes. Diet, exercise, and proper medical guidance can make a huge difference, but the key is awareness, because ignoring these early signals allows the condition to progress silently, leading to complications that are much harder to manage later. Another factor that deserves your attention is acid reflux. Many people don't realize that acid reflux can contribute to dry mouth, especially at night. When stomach acid travels upward into your throat and mouth while you sleep, it can irritate your tissues and affect saliva production. Some people wake up with a sour taste, a burning sensation, or a feeling of dryness that they can't explain. If this sounds familiar, it's worth evaluating your eating habits. Avoid eating late at night. Give your body at least 3 hours between your last meal and bedtime. Elevating your head slightly while sleeping can also help prevent acid from traveling upward, and identifying trigger foods like spicy, acidic, or fatty foods can make a big difference in managing symptoms. Let's not forget one of the most powerful influences on your body: stress. Chronic stress affects everything, including your saliva production. When your body is in a constant state of tension, it shifts into survival mode, and in that state, functions like digestion and saliva production are reduced. This is why people who are constantly stressed often experience dry mouth, especially at night. Managing stress is not optional, it's essential. This could mean creating a bedtime routine that helps your body relax. Deep breathing, meditation, light stretching, or simply disconnecting from screens before bed can help calm your nervous system. Because when your mind relaxes, your body follows, and many symptoms, including dry mouth, begin to improve naturally. At this point, you might be realizing something important. This one symptom, dry mouth, is connected to multiple systems in your body: your breathing, your hydration, your medications, your blood sugar, your stress levels. All of these can play a role, and that's exactly why it's so important not to ignore it. Because your body doesn't send signals randomly. It sends them when something needs attention. And the earlier you respond, the easier it is to fix. Waiting doesn't make the problem go away. It allows it to grow, and what starts as a small inconvenience can become something much more serious over time. So here's what I want you to remember. Your body is constantly communicating with you. Every symptom you experience is part of that communication. Some signals are loud and urgent. Others are quiet and easy to ignore. Dry mouth is one of those quiet signals, but quiet doesn't mean unimportant. In fact, it often means the opposite. It means your body is giving you a chance to act early before something bigger develops. The people who stay healthy long term are not the ones who never have symptoms. They are the ones who listen when their body speaks. They pay attention, they ask questions, and they take action. So if you wake up every morning with a dry mouth, don't ignore it. Use it as an opportunity to understand your body better, because sometimes the smallest symptoms carry the most important messages, and listening to them could make all the difference in your future health.